Hey, this video from Med School Made Easy is going to talk to you about I.O.C, or intraoperative cholangiogram, done doing a biliary surgery and the indications for doing that. First and foremost, if you have elevation in your LFTs or your pancreatic enzymes, like amylase, lipase, etc. If you have a clinical history of jaundice or hyperbilirubinemia, you're going to want to do it. If you have a recent history of some obstruction, which could be pancreatitis, gallstone pancreatitis or biliary pancreatitis, or it could be choledocholithiasis. You want to clear your duct. Sometimes people will do duct clearance through an ERCP or an MRCP. If you don't have those things, you'll definitely want to provide an I.O.C during cholecystectomy to make sure the duct is clear. If you have unclear anatomy, so if during your dissection for a cholecystectomy and you want to better delineate the anatomy, you would do an I.O.C. There's a lot of different ways to do one. If you have really small stones, small cholelithiases, especially if there's a lot of manipulation of the duct or the infundibulum during the case and you feel like you dislodged some stones into the biliary system, you want to do an I.O.C. To make sure that you didn't push one down. If there's a concern for a biliary injury and you see some bile staining, or you think you might have hit a duct, or you think there's a biliary injury, you might want to perform one just to make sure you know the anatomy, know what you're doing. And the last thing I kind of mentioned with your recent history, but if you have an unsuccessful ERCP and you're not sure if you got all the stones out and their labs aren't going down or normalizing, you want to provide an I.O.C or perform an I.O.C during your cholecystectomy just to make sure the biliary system is clear, and decide your next move, whether that's a PTC or spyglass or transcystic duct expiration or something like that. So, all right, and that was the indications for I.O.C.